we are getting ready to perform a little exostectomy or removal of a bone spur from the fifth toe of the right foot. She's already been anesthetized, and now we're going to see how good the nerve block is. And let me know if you feel anything at all. Does that hurt?
No.
And the first thing we're going to do is we take this little scalpel blade, and what we want to really feel for is where was that little bone spur. This is the procedure that's done, everything is done by feel. We'll make a tiny little incision, so there's nothing that we're really opening up on the toe. What we're doing is basically lengthening that incision right down to the bone, and then we're going to use a special instrument and peel the covering on the bone, what we call the capsule, the periosteum, away. We have an instrument almost like a little spatula, and what we're going to basically do is go through the incision we just made and kind of push off or separate the periosteum or capsule from the bone. She's a nice Irish lady, so she's tough. And basically what we're doing is just freeing everything up, and then we're going to get rid of that little bone spur. What we're going to basically do, go right into the incision area, and basically just feel for the bone. Right there, you can see it's hardly anything. Feels good, there's no more bone there. And what we do now is we squeeze out any bit of bone paste, because what that burr does, it basically grinds up the bone and almost makes it look like a toothpaste.
Mm-hmm.
Very successful procedure. I've never really had any complications with this. High patient satisfaction. Now it's just irrigating with some sterile saline. And you really just use one stitch of 4-0 Proline. And just one stitch, and that's about it, and that will stop the bleeding. All right. This is a synopsis of your experience.
It was a very good experience, no anxiety whatsoever. The prep is more involved than the procedure, as you did say, and I'm sure I'll have a little bit of, toe pain later on, but everything is great. I didn't feel one thing.
Okay.